Hi, I'm Art Kaplan. I'm at the Division of Medical Ethics at the New York University School of Medicine. I want to talk about a paper that my colleagues in my division just had out in the journal Health Affairs. Amanda Zink, Lauren Taylor, and a couple of others wrote a very interesting piece, which I think has significance and importance for all those doing clinical care in American healthcare today. So as they pointed out, there's a lot of literature about what makes patients trust their doctor. There are a lot of studies that show that while patients sometimes have become more critical of the medical profession in general, they still generally try to trust their individual physician. Nurses remain in fairly high esteem among those who are getting hospital care. But what isn't studied, and as this paper properly points out, is what can the doctor and the nurse do to trust the patient? How can that be assessed? Isn't that just as important as saying patients have to trust their doctors to do what they're told, to comply with what they're told? What if doctors are afraid of violence? What if doctors are fearful that they can't trust patients to listen or pay attention or do what they're being told? What if they think that they're coming in with all kinds of disinformation, false information, things they pick up on the internet, so that even though you try your best to get across accurate and complete information about what to do about infectious diseases or taking care of a kid with a strep throat or whatever it might be, you're thinking, can I trust this patient to do what it is that I want them to do? One particular problem that's causing distrust is more and more patients are showing stress, showing dependence on drugs, showing dependence on alcohol, and that doesn't make them less trustworthy per se, but it means they can't regulate their own behavior as well. And that obviously has to be something that the physician or the nurse is thinking about. Is this person going to be able to contain anger? Is this person going to be able to handle bad news? Is this person going to deal with me when I tell them that some of the things they believe to be true about what's good for their healthcare just aren't true and are false? I think we've got to really start to push administrators, people in positions of power, to teach doctors and nurses how to diffuse situations, how to make people more comfortable when they come in and the doctor suspects that they might be under the influence or might be impaired or might be angry because of things they've seen on social media, whatever those might be, including, by the way, concerns about racism and bigotry and bias, which some patients are bringing right into the clinic and the hospital setting. So we need more training. We've got to address this as a serious issue. What can we do to diffuse situations where the doctor or the nurse rightly think they can't control, they can't trust what the patient is thinking, how the patient might behave? It's also the case that I think we need more backup and quick access to security so that people feel safe and comfortable in providing care. We have to make sure that if you need someone to restrain a patient or to get somebody out of a situation, that they can get there quickly, that they can respond rapidly, and that they know what to do also to de-escalate a situation. So sad to say, but security in today's healthcare world has to be something that we really test and check, not because we're worried, as many places are, about a shooter entering the premises, which is its own bit of concern, but I'm just talking when the doctor or the nurse says, this patient might be acting up, this patient could get violent, this patient is someone I can't trust. So my co-authors are basically saying it's not a one-way street. Yes, we have to figure out ways to make sure that our patients can trust what we say. Trust is absolutely the lubricant that makes healthcare flow. If patients don't trust their doctors, they're not going to do what they say. They're not going to get their prescriptions filled. They're not going to be compliant. They're not going to try to lose weight or control their diabetes. But it goes the other way. The doctor, the nurse has to trust the patient. They have to believe that they're safe. They have to believe that the patient is capable of controlling themselves. They have to believe that the patient is capable of listening, hearing what they're saying, that they're competent to basically follow up on instructions, including to come back if that's what's required. And everybody has to feel secure in the environment in which they're working. So security, sadly, has to be a priority if we're going to have a healthcare workforce that really feels safe and comfortable at dealing with an increasingly aggressive and increasingly perhaps not as trustworthy patient population. That's not news I like to read when my colleagues write it up, but it's important and we have to take it seriously. I'm Art Kaplan at the Division of Medical Ethics at NYU Grossman School of Medicine. Thank you for watching.